sense of what they're going to talk about in the breakout sessions. But before I do that, one of the things that I happened to witness last week on the Urban Shield opportunity to observe was around the potential hazardous or nuclear waste activity over at the old Novartis facility. And we've been joined this morning by the county administrator, Susan Vernici, who's over to the side. She was also on the exercise. What I witnessed was a chemical operation in which some individuals unleashed some unknown chemical element into the air. What I saw was a coordinated activity on behalf of fire, police, and others to deal with that bioterrorism kind of activity. They ran even the air that was out in the atmosphere in and around the location through some kind of a system which I didn't know that was able to tell kind of what those particles were that were being unleashed. Before they went in to deal with the human aspect of it, which was the individuals who had been, I guess, also by mere fact of where they were caught up in this whole bioterrorism activity that took place. So the scenarios of running those kinds of programs give them an opportunity to continue to perfect it in case we have a real outbreak, be it man-made or human-made or natural disaster. And so again, the fact that we have had major catastrophes over the last 100 years in this area gives them an opportunity to continue to run and perfect as best as possible those operations. The breakout sessions will begin right after the presenters let you know what's going to take place in their area. There will be lunch here at 12:30 for people out to the left, as well as where the breakout sessions will be as well. And again, I hope that you don't just rush out of here, but you take advantage with more face-to-face detailed interaction with presenters that are going to be out there. But I do want to again say thanks on behalf of not just today's activities, but that you take this information back to your loved ones, back to your neighbors, back to the organizations you're affiliated with, and share that information so they too will know how to respond when the next disaster takes place and how to recover when the next disaster takes place. I'm going to ask to lead off, and then the other presenters who are presenting today come to the stage. I'm going to ask Gil Dong from the Berkeley Fire Department, who is going to be one of the presenters in the outside sessions to come up. The other presenters, if you know who you are, if you would come up and line up behind him and give the audience some insight into what they can get from you as they go around to the various sessions. You will have enough time to go around to each of those areas and get the valuable information, the handouts, and the contact information from each of the presenters. We'll start with Gil Dong. And I want to say again to all of the presenters, thank you so much for taking time to be here today.
Thank you, everyone. My name is Gil Dong. I'm Deputy Fire Chief for the Berkeley Fire Department. And I just want to touch base from a city perspective of how your city should respond in coordination with Alameda County Fire and the Sheriff's Department or any other agencies. From the city's perspective, there are 4 things we look at during a disaster or a large-scale incident. And that's response, recovery, mitigation, preparedness. We heard from DRC a little bit about recovery, but every disaster, every large-scale incident is local. So it starts with your local fire department, your police department, public health, public works, whether it's a rainstorm, a terrorism incident, a large-scale fire, or an earthquake. You need to rely on your local resources. So whether you're from Albany, it's Berkeley, Piedmont, or Oakland, we start with local agencies. What are the things that we do to prepare a response? Well, in Berkeley, on November 30th, we'll have an Emergency Operations Center exercise. That's where city staff from all 15 of our departments work together and coordinate how we will respond and request resources to deal with the incident. We also have mutual aid agreements, as Chief Gilbert talked about, whether it's with East Bay Regional Parks, El Cerrito Fire Department, and oversee Kensington, to Oakland, to Moraga, Orinda, and we practice on an annual basis, and we get together at the beginning of fire season to practice and test our communication systems, whether they're radio systems or how we respond. Today we're doing actually 3 different incidents, or 3 events that Berkeley is kind of hosting or participating. So we have today's event, we have the event that's remembering the 20th anniversary of the firestorm. We're also training with Bear Labs on their hazardous materials response team. So we're spread out in resources, and we're relying on everybody else to help fill in some of our gaps. We also work with the ham radio system, our NALCO as they're called, North Alameda County, to communicate during times of disasters, whether it's our cell phones are down or phone lines are down. We have backup systems, and we exercise and work with the North Alameda County radio personnel during our Memorial Day, 4th of July, and Labor Day events, and we work and schedule with them to do tests. One of the things that we thank a lot of our elected officials, we thank a lot of our partner agencies. We also need to thank you as citizens and residents who respond and attend events like this. We also need to thank you for the support that you give us at a local level with support for bond measures or tax measures. In the city of Berkeley, I'm looking at Assemblymember Nancy Skinner, who helped start part of this, and Chris Worthington, who continues it. The number of tax measures, we have close to over $400 million in bond and tax measures to retrofit our fire stations, to retrofit our city hall, to retrofit our public libraries. Without that type of support, we can't reduce the amount of damage that we have on our city infrastructure. So we have to thank you for that. We also thank you for passing Measure GG back in November 2008. In the city of Berkeley, we have provided 52 disaster emergency caches. That's equipment that includes generators, the walkie-talkies, fire hoses, fire extinguishers, and the training that goes along with the equipment to become better prepared and to be ready for the next one. Because this week, we've had an earthquake with 3 aftershocks, and we're overdue. So that on the Hayward Fault, there's supposed to be an earthquake that averages every 140 years, and we're in our 142nd year without having a major earthquake. So I just wanted to touch base on that, and thank you again for all the preparedness that you take, that is an interest as a resident or a committee member. And I'm going to pass it on to one of our partners in the city of Berkeley and let them tell you how public health is an important partner in disaster preparedness and mitigation, and turn this over to Dr. Janet Berryman, the Berkeley public health official.
I want to really echo Gil's thanks to the community and to our partners and to Supervisor Carson for organizing this event and having us all here today. I'm Janet Berryman. I'm the health officer for the city of Berkeley, and Berkeley is one of only 3 cities in the state that has its own public health department. So if you're a resident of Berkeley, I want you to know that you have a health department that is accessible to you right here in your community and that I run. So please come see me. I'll be back at the table there. I wanted to tell you a little bit about the role of public health in disaster response and preparedness. Our responsibility is for the health of our community. And it's a little bit different than individual health responsibility. It's really looking at the community as a whole. So my job is to anticipate and detect and respond to health threats and health issues in our community in the event of a disaster. And so I kind of think of disasters as 2 types. One type is really primarily a public health disaster. And if it's primarily a health disaster, I'm going to have a significant leadership role in that. So for example, when we had the H1N1 flu pandemic a couple of years ago, fire and police didn't have a whole lot to do with responding to that. But I had a whole lot to do over a year, as did Dr. Munzu Davis in Alameda County. And we, very similarly to what you've heard, have relationships and mutual aid agreements, the city of Berkeley with the county of Alameda, with the region, and with the state health department, and even going up nationally. So we have a very similar, somewhat parallel system of mutual aid for health. There are other kinds of health disasters like a bioterrorism attack. in which we would have a lead role for health issues. So we might be dispensing antibiotics to everyone who lives in Berkeley, for example. But clearly law enforcement would have an enormous role in that too, because there's a whole terrorism component which isn't part of what health does. So again, the partnerships with all of the organizations that you're hearing about today are incredibly important, and with you. But the more likely disasters in our community, as we all know, are earthquake, probably first and foremost. And the public health role in an earthquake is really, again, to anticipate and detect and respond to health issues that might follow an earthquake. So that might be, if people are in shelters, what kinds of disease outbreaks might be likely to happen in a shelter? How can we ensure that people who have ongoing medical needs have those needs met in the shelter, even for medical needs that aren't related to the disaster, because people are going to continue to have their asthma or their diabetes. So we have a role in ensuring that those needs get met. And then finally, in educating people about water safety, food safety, how to have supplies and take care of yourself, either in a shelter or in your own home after an event. Finally, I want to say that health departments like to, as others, take common events as opportunities to prepare for uncommon events. So in the same way that many of you were encouraged to come here today by the earthquakes that we had earlier this week, we're embarking on flu season now. And every flu season is an opportunity for the health department to remind people how to protect themselves from infection and how not to spread infection. And those skills work as well during flu season as they do during a pandemic or as they do in a shelter after an earthquake. So those are skills that work now and can help us all be better prepared in the future. Similarly, getting vaccinated for flu protects you from infection and gives us an opportunity to demonstrate our capacity to give medication or vaccines to everyone in our community if there were to come an event in which we needed to do that. So thank you all again for being here, and I look forward to talking to you.
Firefighter Robin Baker, and I am honored to represent the Oakland Fire Department in this joint gathering. As many of us know, the Hayward Fault runs from El Cerrito through Oakland. The hills under Highway 13 from Montclair along 580 towards San Leandro. The last notable quake was in 1989. That was Loma Prieta. That was a moderate earthquake, measuring 6.9 in the last 15 seconds. We all know the damage that it caused: 63 deaths, $6 million in property damage. An earthquake on the Hayward Fault will be much stronger. There's a 2 in 3 chance that an earthquake will happen in the East Bay within the next 60 years. The Oakland Fire Department has a program called the CORE program, which is Communities of Oakland Respond to Emergencies. It is a FEMA-certified CERT program. It's Community Emergency Response, so it's taught to FEMA standard. There are 3 modules for the CORE program, CORE 1, 2, and 3. The underlying assumption for the CORE program is that first responders will be overwhelmed for up to 7 days after the mass casualty disaster. There's going to be possibility of utilities being out of service for days, if not weeks. And so the objective of the CORE program is to teach citizens to organize, do pre-planning, organize themselves, and respond to disasters and help us help them. They're going to set up incident command systems. They're going to get relevant information to the Emergency Operations Center in downtown Oakland so that the response of professional responders can be prioritized. We're going to show you some pictures of the CORE program in our classroom, also some demonstrations of how to cut off your utilities. We'll talk about the neighborhood utilities map, and we'll have a calendar of upcoming CORE events so that anyone who's interested can participate. Thank you.
Hi, my name is Gary Richter. I'm a veterinarian. I practice in Oakland. I also work with...
Can't hear you.
Sorry about that. My name is Gary Richter. I'm a veterinarian in Oakland. I also work with Alameda County and the City of Oakland, working with them on disaster preparedness planning for animals. I am the California Veterinary Medical Association representative for Alameda County for veterinary disaster services. Basically, what I'm here to talk to you about today is how to plan for disaster services and disaster relief for your pets and possibly for animals around you in your community. Prior to Hurricane Katrina, the government policy on evacuation of people with regards to pets was they recommended that people leave their pets at home and evacuate to shelters or wherever they could evacuate to. What became clear in the aftermath of Katrina is there were two distinct problems with that plan. Number one is it's sort of the obvious plan that many thousands of animals died because of that plan, because people could not get to them and help them. And perhaps equally as significant was people who either left their pets and evacuated and then tried to get back to them later, or people that refused to evacuate because they would not leave their pets became a public issue from the standpoint of the first responders, because then the first responders had to go in and rescue those people when otherwise they would have been evacuated at an appropriate time. So in the aftermath of Katrina, the government recommendation at this point is that you evacuate with your pets. The particular hang-up that we have at this moment is Red Cross shelters do not accept pets when people evacuate. So there's a little bit of a disconnect and a conundrum right now that has not been completely worked out. But so you can imagine that people evacuate with their pets, they show up at a shelter, and then they're not admitted to the shelter because they can't come in with their pets. So presently, what's going on is I am working with both the county and the city of Oakland to set up what we are referring to as parallel animal shelters. So these are shelters that will be set up next to or in close proximity to Red Cross shelters, so that when people come to check into the shelter, they're able to check their pet into the animal shelter and then go be admitted to the Red Cross shelter. So that is an ongoing project with the city and the county. There's quite a lot of work to be done in that regards. But specifically, what I'll be here to speak with people individually about today is what is it that you can do to be prepared for a disaster with relation to your own personal pets. So what are the things that you should have on hand? What are the things that you should know from the standpoint of basic pet first aid? And when it comes to animals and disasters, there's an issue of first aid. There's also an issue of safety. Animals, when they are scared, they sometimes tend to bite people, and there are ways to protect yourself, ways to be careful. Even a beloved pet that has never had a nasty word to say to anybody in their entire life, if they are in pain or they are scared, it is a very, very different story. So I can help you sort of determine what the appropriate ways to assess the situation is and how to best help your pet. I will be in room 126. I have, there should be a list in the handouts that you guys got of sort of a basic list of things that you might consider keeping in your preparedness kits at home specific to your pets. I will have some other stuff, some more specific things by way of first aid equipment that we can talk about in room 26 when I'm there. And if you have any further questions with regards to pet sheltering and how that is going to be handled, I'll be happy to discuss it at that time. Thank you.
Hi, my name is Bill Ferguson. I'm with Eden INR, and we provide 211 service countywide. 211 is an easy to remember 3-digit number that people can call for referrals for health and social services. So we have a database of all the programs in the county, both county government agencies, and also nonprofits. And so we have we provide information to people on things like low-income housing, subsidized housing, where you can go for low and free health assistance. There's some programs out for rental assistance and PG&E assistance when people get behind on that. Suicide prevention, drug treatment, so people can call 211 for information on health and social services. 211 is also the number to call for after a disaster for information. Not to replace 911. 911 is still the number to call for life-threatening emergencies, but 211 is to get information. Things like which roads are closed, which hospitals are closed, where the shelters are going to be, where to get food and water, and if you're not as affected and would like to volunteer, it's also the number to call to volunteer. So 211 is the number to call for information after disaster. Come on down and talk to me more. We're in room 125 down the hall. Thank you.
Hello everyone, my name is Aditi. I'm from the American Red Cross, and the mission of the American Red Cross is to prepare for, respond to, and recover from disasters. So we are part of the Bay Area chapter, which covers 6 counties in the greater Bay Area, including the county of Alameda. We have a lot of information here for you today, including our lines of service, including disaster services, as well as free preparedness information. Along with all the information, our fun activities. So we have booths on first aid and preparedness, and also you can get trained in citizen CPR, which is basically hands-only CPR. Today we're in room 106, so we look forward to meeting you. Thank you.
Good afternoon. I believe it's afternoon now. I am here to represent CARD, Collaborating Agencies Responding to Disasters. We were created after the Loma Prieta earthquake. We were born in the aftermath of the Oakland Hills fire. Actually, could somebody please, would you please raise your hand if you volunteer with or belong to or volunteer with any kind of nonprofit or service organization? Anybody here connected with any faith-based organizations, any kind of congregations? So if you are in any way connected to a faith-based organization, service agency, or not-for-profit, you're one of 10,000 such organizations that we represent. We would actually be the point of contact and communication and coordination at the Alameda County Emergency Operations Center, should that have to be activated. We'd be there to advocate for you and be your voice. We're going to be down the hall in room 104, down at the other end from here. And we are actually there to show you how it is possible to make preparedness fast, fun, and easy. So if you haven't gotten prepared because you think the topic's just a real bummer, it's like really blue, if you haven't gotten prepared because you think it takes too much time, we can show you things like how you can simply put a whistle and flashlight on your keychain. And that automatically makes you infinitely more prepared, so much more prepared than you would be. Come by and visit us, see if you can get a whistle from us, and you'll leave this here being more prepared than you were when you first came in. Anybody know MacGyver? If you don't know MacGyver, MacGyver is the spy who didn't carry a gun, who fought his way out of situations with a roll of duct tape and a Swiss Army knife. We will teach you to be prepared to prosper. Not prepared to be scared, but prepared to prosper by taking the MacGyver approach and learning how to be resourceful with the tools that you have. What's the most important resource? Yes, right there. Everybody's pointing to their head. It's your brains. So come down and see us. See about the MacGyver approach. Learn how to fasten things that don't fall off the walls. Learn how ICS, the Instant Command System, can actually be fun and easy. Learn all these wonderful skills. Learn how to make your own preparedness kits. We like to call them skip kits. Safety kept in place. Something you can keep in your backpack. Come see us down in room 104. We'll be happy to talk to you and see how we can help serve you and your needs. Thank you very much.
Good afternoon, everybody. I am Terry Garrison, and I am with the Alameda County School Emergency Managers. Oh, sorry. Is that better? Terry Garrison with Alameda County School Emergency Managers, and what we are here today is to explain what the schools are doing in preparation for disasters and emergencies. So down in room 108, I'll be explaining what the site plan disaster plans that the school districts have put together to keep the kids safe and the staff safe. And also, our big thing that we'd like to explain to you also is the student release and family reunification policies that we have. So please come see me in room 108. I'll be happy to explain that and answer any questions about any standard operating procedures that they do have at the school districts and what the School Emergency Managers Association is. Thank you.
Good afternoon. I'm Dr. Montu Davis. I'm the County Health Officer for Public Health. I won't describe in terms of what we do. Much of what Janet Berryman mentioned earlier is what we do. I did realize now after hearing the sheriff and the chief talk, we actually also coordinate Region 2 in terms of California for medical and health disasters. Just to explain what the medical health system is, I'll give you an acronym. It's HELP with 2 P's. H is for hospitals or healthcare systems. So we work with the healthcare facilities, including the clinics and long-term care facilities, to make sure that they have what they need and have guidance in terms of treating you once you come in. We also work with the emergency medical service system or the transport system that gets you from out in your home into the hospital or any other healthcare facility. We also work with the labs. The labs help us make our diagnosis and understand what's happening with you when you get injured or hurt after an emergency. We also work with the physicians or providers who are actually the people taking care of you and providing you care, whether it be out in the field or in the hospital. We work and coordinate with them as well. And the last P is public health, in terms of looking at the overall health of the community and assessing what is overall happening, not just with individuals, with everybody in terms of different areas of the community and what their needs are. So come and visit us in room 128. We'll talk to you about what we do in more detail, give you some overview of a timeline of what happened during pandemic influenza. And you see this scary little picture up here. In the spirit of Halloween, we have Operation Zombie, so we'll talk to you about preparing in that fashion. Thank you very much. 128.
In room 102, you're going to have representatives of the Berkeley, Oakland, and Alameda County Fire Departments to provide you information on how to map your neighborhood, to participate in a community emergency response team, or if you're from Oakland, to participate in the citizens responding to emergencies. And we do have a gas meter for you to practice shutting off your meters manually if you need to. So come to room 102. I'm going to turn this over to Supervisor Keith Carson, and on behalf of the City of Berkeley, thank you for coordinating this event.
Once again, lunch will be provided starting outside to your left. You'll see that you got just a snippet of all the good information you can get and ask questions directly to the providers, and you have the rooms which are located right behind me. So we hope that you'll take advantage of those. All of the presenters, all of the sponsors, and especially to you, because this wouldn't have worked if you had not been here. We hope that you'll take this information back to your friends, your neighbors, your loved ones, your people you don't even like, but you I want to say thank you, all of you, for being here. Take advantage of your